All right, well, welcome. This is Blood Vodcast number 5, Blood Typing. And let's take a look at the different types of blood that we have. Well, we all know there are 4 different types of blood: type A, type B, AB, and O. But a lot of people don't know what makes them individual blood types. Well, blood type A has some antigens, specific antigens, which are identifiers on the in the membrane of the red blood cell. Type B has a different type of antigen called a B antigen. Type AB blood has both A and B antigens. And again, these are identifiers so your body knows that these belong in your body and should not be attacked by cells in your body. And then type O blood does not have any kind of antigen. Well, in the blood plasma, we have, for type A blood, with the A antigen, we have the anti-B antibody. And this means that essentially that if type B blood is introduced into type A, you're going to have a little battle going on. You're going to wind up with a coagulation and destruction of the blood cells. And type B has type A antibody. Type AB doesn't have any antibodies because it recognizes both A and B as okay in the body. And then type O has both A and B antibodies. So these blood cells are marked by genetically determined glycoproteins and glycolipids that are embedded in the cell membrane of the red blood cells. Well, based on those glycolipid isoantigens that are found on the surface, we have identified the 4 blood types. Well, plasma contains those isoantibodies or agglutinins to the A or B, whichever are not found in your blood. So anti-A antibody reacts with antigen A, and anti-B antibody reacts with antigen B. Okay, next slide. The Rh blood groups, well, there's another factor involved. There's a number of factors, but the other factor we're going to look at is the Rh in blood groups. Rh comes from the first 2 letters of the rhesus monkey, which was used in the discovery of Rh factors. And people with Rh agglutinogens on the red blood cell surface are considered to be Rh positive. And normal blood plasma does not contain any anti-Rh antibodies. So if you have the Rh agglutinogens on the surface of your red blood cells, you're considered to be Rh positive. And you'd be Rh negative if you don't have any Rh agglutinogens. Okay, antibodies develop only in Rh negative blood type and only with exposure to the antigen. This occurs with transfusions of, has an impact on transfusions of blood, positive blood, Rh positive, and during pregnancy with a positive blood type fetus. What happens is a transfusion reaction upon a second exposure to an antigen results in hemolysis of the red blood cells in the donated blood. And we're going to see that in just one second. Hemolytic disease of newborns is a problem where Rh negative mom, that's one without those antigens, and an Rh positive fetus, and that could come from the father, will have a mixing of blood at birth. Mom's body then creates Rh antibodies, which are going to oppose any future Rh positive blood that it finds in its blood system. And that will happen unless she receives a special injection, a RhoGAM shot, very soon after the very first delivery, or miscarriage, or abortion, any of those 3. What RhoGAM does is it binds to loose fetal blood material and removes it from the body before the mother starts making antibodies. In the second child, if you don't remove those antibodies, hemolytic disease of the newborn may develop, causing hemolysis of fetal red blood cells and either miscarriage or severe other problems. While transfusions and transfusion reactions occur, when we transfer whole blood cells or plasma into the bloodstream of a recipient, we do this because we're treating anemia, severe blood loss, or other very specific diseases. Leukemia would be one. Sometimes sickle cell anemia, where we actually transfer all the blood out of the body and replace it with new blood. Well, what happens when you have an incompatible blood transfusion? Well, antigen-antibody complexes form between the plasma antibodies and the foreign proteins on the donated red blood cells. And this causes agglutination, clumping of the red blood cells. Donated red blood cells can also become leaky, and they burst. And that loose hemoglobin in your bloodstream can cause significant kidney damage. Well, when you donate plasma, one of the benefits of donating plasma is that plasma does not contain very many red blood cells. It's really too diluted to cause any problems. So you can give a person plasma, which helps maintain blood volume. Well, the universal donors and recipients, people with type A blood, are called universal recipients, since they have no antibodies in their plasma, and therefore they can accept any kind of blood. Makes no difference what kind of antigens are on the blood cells. People with type O blood are called universal donors, since they have no antigens on their cells, so that when they are introduced, there's no antibodies in the plasma that would cause any problems. Now, typing and cross-matching blood, right? We need to make sure before we give anybody a blood transfusion that we are not mixing incompatible blood types. That will cause agglutination, which is visible clumping, and you will see the formation of antigen-antibody complexes that causes cells to stick together. Now, this is not the same as blood clots, because blood clots have a very specific process releasing very specific clotting agents. So typing blood really involves testing blood with a known antisera that contains the antibodies for A and B, or Rh positive. What are some of the diseases that we have from blood? Well, one of them is anemia, where there is not enough red blood cells typically. Right? The symptoms of anemia, a person with anemia, would be loss of oxygen carrying capacity. So therefore there's some problems with respiration. There's also fatigue, cold intolerance, and paleness. Well, the cause of that is with not enough red blood cells, or not enough iron in the blood carrying oxygen. There's a lack of oxygen, which reduces the generation of ATP, and then as a result, there's not enough ATP to run the muscle cells and cause production of heat. So people tend to feel cold. There are several different types of anemia that we're going to look at. One is iron deficiency, and this is either a lack of absorption of iron into the red blood cells and hemoglobin, or a loss of iron. Oftentimes this is caused by lack of iron in your diet, and you get iron from either red meat, or from dark green leafy vegetables like spinach. Pernicious anemia is a lack of an intrinsic factor, that's one factor inside your body that helps with B12 absorption and vitamin B12. And what happens here is that the iron in the red blood cells cannot absorb enough oxygen. Hemorrhagic would be the loss of red blood cells due to bleeding. Oftentimes this is internal bleeding, ulcers, which typically develop in the stomach or the small intestine. And as a result, these things continue to bleed. They can't heal themselves because of the acid in the stomach and small intestine, and therefore they keep bleeding. And this is a problem. Doctor typically determines this with a stool sample. Hemolytic anemia is a defect in the cell membrane, which just causes red blood cells to rupture. And then two others, thalassemia, is a hereditary deficiency of hemoglobin. And aplastic anemia is the destruction of bone marrow, and this is where we produce red blood cells, oftentimes caused by radiation or chemotherapy. Sickle cell anemia is found in populations in the malaria belt. Now, the malaria belt is Mediterranean, Europe, sub-Saharan Africa, and Asia. Malaria is carried typically by the Anopheles mosquito. That bites an infected person, passes along the plasmodium to the next person that it bites. Well, sickle cell anemia is a genetic defect in hemoglobin, and it changes two amino acids. And as a result, the cells, red blood cells, are not shaped properly, and they rupture easily, and they cause anemia and blood clots. If there's a benefit to this, this is the fact that people with sickle cell anemia tend not to suffer from malaria. Even a person with only one sickle cell gene, that they're a carrier but don't come down with sickle cell anemia, wind up with increased resistance to malaria. And this appears to be because the red blood cell membranes leak potassium ions, and the lowered levels of potassium seem to kill a parasite that's infecting the red blood cells. Hemophilia, another blood disease, and this is a deficiency of clotting factors. Hemophiliacs bleed spontaneously or after very minor traumas. Sometimes it's subcutaneous and intramuscular hemorrhaging, so you don't even see the blood loss. Oftentimes you see just spontaneous nosebleeds, blood in the urine, articular bleeding, and pain. Three types of hemophilia. Hemophilia A, the most common, lacks clotting factor 8, and that's the hemophiliac clotting factor. This is obviously most common. Hemophilia B is somebody that lacks clotting factor number 9. Affects males only, and I didn't say that about hemophilia A. That affects males only. Hemophilia C is much less severe. It affects males and females, and it's less severe because there are alternative clotting factors that exist. Disseminated intravascular clotting. These are life-threatening diseases, and it's caused by a lot of clotting factors that are removed from the blood because there's so much clotting going on in the blood on a consistent basis. It's also associated with infections and hypoxia and low blood flow rates and trauma, hypotension, and hemolysis. And the clots cause ischemia and necrosis, which leads to death of cells and multi-system organ failure. Leukemia. There are two kinds of leukemia that we look at. Acute leukemia, which is the uncontrolled production of immature leukocytes. And this prevents or reduces the production of red blood cells and platelets in the bone marrow. Chronic leukemia is an accumulation of mature white blood cells in the bloodstream. And this is because, for reasons that are not yet fully understood, the white blood cells just don't die. And chronic leukemia is classified by the type of white blood cell that's predominant. If it's monocytic, because monocytes are the problem, or lymphocytic, because those lymphocytes are predominant. Iron deficiency is another problem that people have. Remember that iron is what carries oxygen, and iron is lost in the blood occasionally due to hemorrhage, menstruation in women, and must be replaced by the diet. And on average, men need half as much iron as women do. So that's the end of our lecture today. Hope that if you have any questions, please ask them in class tomorrow. And if there are no questions, we'll just proceed with our class activities. Thank you very much.